Moments with Dr. Greta are brought to you by the Ashley Clinic in Chanute, Kansas. A tale of two noses and saline hygiene. It's time to talk about using that saline pretty much every day to try to keep your children from having really serious infections. Here's the saying. 'Twas a long winter night, and all through the home there was coughing and sneezing. Germs freely did roam. Now with coughing and sneezing, the germs are dispersed, lasts 14 days or 2 weeks. Whichever comes first. So ask for each kid which treatment is best. Call if of fever, not eating, or otherwise stress. Now we want to give you some literacy stuff, so here's Dickens saying, it was the best of times, it was the worst of times. So first of all, there's the best of times, using daily saline before the kid gets sick. Here goes. 'Twas a long winter night, and all through the home there was coughing and sneezing. Germs freely did roam. But Mom with the saline spray at her side and Dad with the sucker were there at bedside. But they had been using the saline each day, so less suctioning needed, more sleep on the way. Now for the worst of times. This is where you're not using the saline. The kid isn't used to having it, so then when they get sick and they have so much secretion, they cannot let you use the saline. There's a lot of moaning and groaning and yelling and screaming, so you got to just forget it. Don't make the kid cry more. Don't hold them down with the saline if they're not used to doing it in the first place. So now, the worst of times. 'Twas a long winter night, and all through the home, you remember the poem before. From one to another, the nose woes progressed. Mucus flow was too slow. No one got any rest. You've just got to get through it, but call if you're worried. This too will pass, but the germs can't be hurried. So, when everyone's better, what's the next move? Use saline often, the flow to improve. Give that kid a hug.